Hi everyone, it's me, Dr. Sarah Sedek. Welcome to Smart Braces and Invisalign, a channel filled with all things teeth and braces related. How are you all today? I hope everyone is well. So in today's chat, I'm going to be discussing how to brush your teeth with braces. Hi Bridget, how are you? So, the first thing I'd like to say before starting the chat is that the content seen in this video is not intended to provide personal health or medical advice. The information provided is purely for educational purposes and is not a substitute for professional dental diagnosis or treatment. For personalised medical, health or dental advice, please be sure to consult with your dentist or healthcare provider immediately. And the structure of this clinic is such that I'm going to start by saying a few hellos to everyone. Perhaps you can tell me whereabouts in the world you are. And I'm then going to discuss why it's so important to brush your teeth with braces and how to brush your teeth with braces. And I'm also going to answer a few questions at the end of the chat. So please do prepare any questions you may have. So let's see who's here today. Okay, so we've got Zoella Fleming. Hi Zoella, how are you? Zoella, whereabouts are you? Hi, Sulalali. Hello, Dr. Sarah, and everyone watching Brushing Teeth with Braces on her global clinic. Stay safe. Hi, Bridget. So excited to join. Thank you so much for joining, Bridget. Bridget's in Arizona. We've got Dr. Khalid Sadek. Wow, it's an honor to have you joining. So Dr. Khalid Sadek, if anyone is interested, he has a fantastic pimple popping channel and he does some amazing surgery on there, so check it out. Sherry S, hi Dr. S, my first time here, don't tell Doc K. Well, he can see you, yeah, quite rightly. Oh dear. Faithful Vibes, hi there, hi Faithful, whereabouts are you? Suzanne Burtz, thank you so much for joining. Hi Doc Sarah, I hope everyone's having a great Saturday. It's Faith, okay, great, nice of you to join Faith. Tell me, whereabouts are you? So, shall we start off with the chat? Okay, so braces are basically used to give your teeth, to give you a healthier, to make your teeth straighter and healthier, and your teeth can get really damaged and discolored. Now, whether or not you have braces, you can experience teeth problems. So this video, I hope, will be useful to people even if they don't have braces. But the facts are that if you do have braces and you don't brush your teeth well, then the risks are essentially much higher. So this is why this video is so important, especially if you do have braces. Now, some of the major issues that can be associated with having braces are gingivitis, periodontitis, and decalcification. And I'm just going to briefly cover these for you. So gingivitis is where the gums are basically swollen and they're puffy and they bleed easily. And it is caused by plaque building up on your teeth around the gum lines. And it's basically the first stage of gum disease. I'm sorry, I'm saying basically a lot. I noticed this when I was watching my videos last time. And so gingivitis is essentially the first stage of gum disease. So it is a type of gum disease, so it's quite serious. And it's caused, as I said before, by the accumulation of plaque on your teeth. And what plaque is a mixture of bacteria and food debris, and it collects along the gum line. So sometimes you may notice, actually, you can see what plaque is occasionally. If you wake up in the morning and say you've been a bit naughty and you haven't brushed your teeth the night before, if you scrape your teeth and you get this white stuff, then that's actually plaque. And it's basically food debris and millions of bacteria. So if you looked at that stuff under a microscope, you would find that it's packed full of millions of bacteria. It's pretty gross. And yeah, and when people have braces, that can collect really easily. And I have seen cases where there is so much plaque on their teeth that I could probably scrape it off and make, you know, there'd be enough to scrape off to make, I often say this, to make a Philadelphia sandwich. And I know that sounds really gross, but sometimes you get so much plaque on teeth that there's, you know, you could just fill a whole jar up with it. Now, the second stage of gum disease is called periodontitis. Now, if gingivitis isn't treated, it can lead to periodontitis. And the signs of periodontitis are gum infection and inflammation And this basically spreads to the bones and the ligaments that support the tooth. So it's a much more severe stage of gum disease. So you really want to avoid, this is why treating the gingivitis is so important. Now, the third most common problem that you can get if you don't brush your teeth well when you have braces is decalcification. Now, decalcification are permanent stains that form around the braces, and they're often called white marks. Now, these spots can permanently stain your teeth. So that's why it's so important to take preventative measures to stop this from happening. So some people, when they have their braces removed, you may have noticed this on some of your friends, for example, that when they have their brace removed, they have white marks on their teeth, and this is decalcification. And decalcification, if it's left, can actually progress to tooth decay. So this is why you really don't want your oral hygiene to reach this stage where you have decalcification, because decalcification is essentially can progress to tooth decay, and the last thing you want is to have sort of like straight teeth with holes in. Okay, so now I'm going to move on to how to brush your teeth with braces. How's everyone doing? Hi Alessandra, how are you? Hi Faith, you've got light pink braces on, fantastic. Janan's got a question for me which I'll answer later. Okay, so next thing, brushing your teeth with braces. If you're enjoying this video, please do give it a thumbs up. So next thing, brushing your teeth with braces. So there are lots of gadgets on the market. If you have braces, I'm sure you will have seen that there are so many different things that you can use to brush your teeth. And I am going to run through a few of the things that I recommend most commonly to my patients. However, I always recommend that you should follow the advice that your dentist or hygienist or orthodontist has provided you individually, and they should have provided you with a treatment plan to help you through your braces. So the first thing I recommend using to my patients is a proxy brush. Now, this toothbrush here has two ends. So one end has a thin kind of like single tufted brush, and the other is just a normal kind of toothbrush. And I'm going to show you how to use this on the brace. So this is the first thing that you need to do. Just try and figure out how to use this. Okay, so with the proxy brush, what you need to do is you essentially place the brush in the area between the brackets underneath the wire. Okay, so I don't know how well you can, underneath the wire and between the brace. And you do this all around, all your teeth. And you should also have some toothpaste on your brush as well. And again, you do it around the bottom. Okay. So that's the first stage that I recommend when it comes to brushing your teeth. Now, the next stage involves using your toothbrush. Now, whether or not you use an electric toothbrush or a manual toothbrush is something that you can discuss with your dentist or your orthodontist. But I'm going to show you how to do it with both. So, what you need to do is you start by angling the toothbrush at a 45-degree angle away from your gums and towards the brackets, essentially. Okay, and you spend 5 seconds on each tooth at this angle. You then change the angle so that it's flat against the brackets, and you spend 5 seconds at this angle on one tooth, and you then angle it upwards towards the gums, and again you spend 5 seconds at this angle, and you repeat this on each and every tooth. So again, away from the gums, flat and upwards. And you do it the same for the bottom, so away from the gums, flat and upwards. And you go all the way around, spending 5 seconds on each tooth at that angle. And you also need to make sure you're brushing the biting surfaces. Okay, so here I am brushing the biting surfaces. And once you finish brushing the biting surfaces, you need to brush the inner surface. Okay, so now I'm going around the inner surface, and that's essentially how you brush your teeth with braces with a manual toothbrush. Okay, so if you don't use a manual toothbrush and perhaps your dentist has recommended that you use an electric toothbrush, then I'm going to show you how you do it with an electric toothbrush. It's pretty similar. So here we have an electric toothbrush. So this is a sonic electric toothbrush, and I'm going to show you what you do. I'm going to switch it off because it's a little bit noisy. So again, you hold the toothbrush at for 5 seconds towards it. And you, with the electric toothbrushes, the main difference is that you don't need to move it as much, whereas with a manual toothbrush, you do need to make a circular kind of motion as you're doing each movement. So that's essentially when you're brushing, but the electric toothbrush, the brush essentially does the work for you. So it's a little bit easier. Now, what other little bits do I have to do? Do I have for you? So here we have interdental brushes. Now these I absolutely love. I have produced an entire video on interdental brushes, so please do check it out. But interdental brushes, if you don't have braces, these are also fantastic. And I'm going to show you how to use an interdental brush. So what you do with your interdental brushes, or what I do, is I place a little bit of toothpaste onto the back of my hand. I dip the interdental brush into the toothpaste, and you then place the interdental brush in the area underneath the bracket and above the gum and just beneath the tightest contact of your teeth. So our teeth are what we call sort of slightly barrel shaped. So if we imagine that this is the gum underneath here and this is the top of the tooth where the tips of my fingers are, you need to basically place the toothbrush into this area here, just underneath the tightest contact. And that's the area where plaque and bacteria accumulate most commonly. And you do that 4 or 5 times across each tooth and every surface. And that will also make sure your teeth are really clean. Now, my next top tip. Is flossing. Now, how do you floss with braces? Now, flossing with braces is really difficult, I have to admit. But I am going to produce a separate video on this because it is a topic that I can't cover quickly, and I don't think it's going to show up very well in this live chat. So I'm going to produce a proper video on how to floss with braces. But if you have braces and you're wondering how to use floss, then the trick is to use a threader or to use super floss. Floss itself is very thin and very flimsy, and if you're trying to poke it in between your brace and your teeth, it's not going to go in very easily. So that's why there's special floss that has floss threaders or super floss, and it contains a slightly plastic firm tip. And you just use these and you sort of can poke them in easily, and it's much easier than flossing with normal floss. Now, my next top tips are to always carry around with you some pocket-sized toothpastes. Okay, these are a lifesaver, whether or not you have braces. Now, I just love these. I have one in my handbag all the time. You can get them from your dentist sometimes. Use them whenever you need, and you brush your teeth as needed, and they just freshen up your mouth, especially if you have braces. It's so important because you don't want to have food collecting and food basically gets stuck on your teeth when you have braces. So the next thing is, I don't know how many of you use these, but this is a water flosser, and I did a poll on this on my YouTube channel. I found that they are quite popular actually, but water flossers are also really good, especially for braces, because they do get rid of the food and debris that collects around the brace. They aren't a substitute for normal flossing, so don't think that just because you're using a normal normal floss, you do still have to floss normally, even if you're using a water floss. So please don't think that this will be enough. And they're quite noisy, so I'll just show you. See, a little bit of water came out. So that's the next top tip. And the other thing is just carry around a toothbrush with you. So here we have, this is just a travel toothbrush. Really handy again, just carry a toothbrush in your handbag, and it means that you can brush your teeth whenever you want. What else was I going to say? 1 second. The other thing to remember is that you need to remember to change your toothbrush. This is actually seems really obvious, but if you have braces, the toothbrush does actually get worn quite easily. I think it gets worn down more than if you don't have braces. And often when my patients will come in and they'll bring in their toothbrushes with them, and the toothbrush is really frayed and old. So make sure you check your toothbrush quite regularly, and bring it with you to your dentist appointment. Your dentist will be able to tell you whether or not it needs to be changed. The more, if you change it regularly, then it's going to be more efficient basically. So make sure you check your toothbrush, because if the bristles are frayed, then it's not going to work as well. Now, the next thing is watch what you chew. So certain foods are sticky, so you need to be careful with sweets, things like that. Obviously, you shouldn't really be having sweets when you have braces. If you are going to have the occasional sweet, then do make sure you brush your teeth afterwards or rinse with a mouthwash. Now, fluoride mouthwashes are also really useful if you have braces. I did have some here, but I don't know where it is. And but they're really useful as well. So I think let's go to the floor and see what questions we have. So, Janan, should I put braces on and move my teeth together because I have a lateral incisor missing, or should I move the teeth apart and put the tooth implant later on? Anger, my braces come off. I love you. Thank you so much, Janan. That's so kind. Now, there are two options when it comes to opening or closing spaces for teeth. Now, it sounds like you're just missing one tooth on one side. So it's kind of like, it really is case dependent. So I, for example, am actually missing a lateral incisor exactly the same as you, and I kept the gap closed, but it does have its disadvantages. So there's less symmetry. If you open up the gap, then it's likely to be more symmetrical. But closing the gap means that you don't have to have an implant, as you say, or a bridge. So it's kind of like there are pros and cons to each situation. What I would advise is discussing it with your orthodontist. Find out to see what they recommend for your case, because sometimes it is very case dependent and closing the gap won't be an option. And sometimes also opening the gap won't be an option. So have a chat with your dentist or your orthodontist and see what they recommend. Okay. Ooh, there's lots of comments. Okay. Do you happen to have any pictures of these? Sounds eerie. Bridget liked. Yeah, I'll find some pictures of teeth with plaque all over them. It's pretty gross. I'm fine here. Great. Also like to know, Janan, thank you. Sulalali, very good filming, filming. Thanks for it. Sulalali, I mean, brushing braces with an angle going all the way around. Dr. Sarah, would you recommend brushing first or water pick? Good question. So, I would recommend brushing first. You know what? This is actually, people are a little bit divided between whether or not they should brush first or water pick first. Most people say water pick first and then brush, because you still have the fluoride from the toothpaste around after you've brushed your teeth. It's really entirely up to you. I have to admit, I don't use a water floss a lot. I prefer regular floss more. But yeah, normally you floss first or water floss first and then brush your teeth afterwards. Okay, filming the electric toothbrush a little bit easy. Suzanne Burt, Doc Sarah, what's your opinion on the new water pick toothbrush combo? Yeah, so I think it's really great. I've heard good reviews about it. I haven't actually been able to try it myself yet, but I do want to try it. And as soon as I do, I'll let you know. I might actually buy one just to try it out. They're a little bit pricey though, aren't they? The more I learn about health topics, the more I admire these professionals. Thank you so much, Alessandra. You're too kind. Paolo, hi. Ciao, Paola. Sulalali, thank you for all your top tips, Dr. Sarah. I'm learning my daughter finds it easy. If the orthodontist will evaluate my daughter on this Thursday, tell he'll put braces on here. I'll invite her to watch all these videos. Yes, please do. I hope she finds them useful. Suzanne, but do you or your brother have braces? I've had braces. Yeah, I don't think Doc K hasn't, although I'm trying to persuade him. I want to put some braces on him because I'm really fussy about straight teeth, but I haven't been able to convince him yet. I'm thinking maybe Invisalign would work quite well for him. What do you guys think? Do you think he needs braces? Alessandra Testa, I agree with you. We need continuous learning when it comes to health awareness as science is developing, and we need to look after ourselves. Take care. Very true, Sue. Hi, Alexis. Oh, it's your birthday. Happy birthday, Alexis. I hope you had a fantastic day. Prince of Zam. Hi, Doc. Great top tips. Thank you so much, Prince of Zam. Aquan Warith. Do you recommend soft brush or hard toothbrush? I do recommend soft brushes always. I don't recommend hard brushes at all because they are actually too damaging for your gums and they will cause gum recession. And once the gum is gone, it's gone. You can't bring it back. So I always recommend using a soft toothbrush. Doc, I bought some of those Interdental interdental wires or interdental brushes. Interdental brushes, they are fantastic, aren't they, Prince of Sam? Once you start using interdental brushes, you don't stop because you realize how good they are. Prince of Sam, I've converted from water floss to regular floss every day. That's interesting. Why did you convert from a water floss to a regular floss every day, Prince of Sam? I'd love to know. Alexandra, thanks a lot for your top tips. Opinion on general teeth and care, it helped me a lot this week. When I went to the dentist and accepted her to start taking care of my smile. Thank you so much, Alexandra. That's so kind. I've done a braces installation video. It's on my YouTube channel, so please do check it out. Remember, if you haven't subscribed, guys, please do subscribe and don't forget to hit the like channel. Don't forget to hit the like on this YouTube video. What else do we have here? Okay. So, I developed really bad sensitivity from the water floss stop. Why do you think that happened? Oh, that's interesting. I don't know why you would develop sensitivity from water floss. Perhaps it was a little bit too strong and maybe it caused a bit of gum recession. I don't know. What about receding gums and braces? Any suggestions to prevent gums shrinking? Yeah, so essentially gums shrinking from braces is normally caused by not brushing your teeth very well. So gingivitis, gum disease causes the gums to recede, and that's how you get gum recession. Okay, so are we all done? So I think we're all done. We've chatted for quite a while. It's funny, time just flies by when I'm doing these. It doesn't feel like I've been chatting for 20 minutes, but I have. So we've got loads more questions suddenly. I brush my teeth. Oh, my teeth are eligible for closing the gap, and I can also move the tooth, but my author said he wants us to decide, so I want your opinion. You know what, it's really hard for me to say, Janan, without seeing your case, so I wouldn't want to say one way or the other. It's really difficult. Chantel Cotton, I brush my teeth at least 4 times a day and floss, use interdental brushes, but I can still see a bit of plaque build up around my brackets on the bottom. Oh, there shouldn't really be plaque. I mean, just brush a little bit more thorough. Sometimes what I recommend is putting your look down as you're brushing. That really does help you get the brush in there properly. And spend a little bit longer brushing and make sure you do the circular motions, Chantel. Sounds like you're doing really well though, so you can't be doing too bad a job. Dr. Sarah, when is the next video? Next video will hopefully be Wednesday. I haven't decided on the topic yet. If you have any suggestions, please do leave me a comment. Never had braces, but had a very slight overbite. I sometimes scrape the inside of my mouth when eating. Is that all related? Possibly. That possibly is, Sherry. Maybe you should book in with an orthodontist to get a consultation. So thank you all very much for watching. I hope you've enjoyed this video. Please don't forget to hit the like if you haven't already. And if you're new to this channel, then why not hit the subscribe button as well. Bye. Oh, I can never close this. Thanks, everyone. I'm gonna have to just close it.